Good afternoon, everyone. Thank you for joining us. My name's Addie McClellan, the Community Engagement Manager for United to End Homelessness, filling in today for Bex Hayhoe, the Executive Director of United to End Homelessness, who usually does these community chats. If you tuned in for last month's community chat where we talked about the Orange County point in time count data from this past year, you can find the recording for that chat on our YouTube page or on our website. So if you'd like to learn more and rewatch what we talked about with the speakers that were on for that chat session. Today, we are very excited to have a very prominent speaker come to us to talk about a trend that is happening across the country. And it's a trend that we're also seeing here in Orange County as well. So in the 2022 point in time count, we saw that there were 718 seniors who were homeless in our community in 2022. And this is a fairly big increase, about 17% increase from the numbers that we saw in 2019. And this increase, like I said, is reflective of trends that are happening across the nation. So in light of the recent data that's come out, and since this past Sunday, August 21st, was National Senior Citizens Day, we wanted to launch a community chat series that is looking at this concerning trend of older adults and seniors and homelessness. Today is the first in the series where we'll be looking at what senior homelessness looks like at that national level, at this bird's eye view. And to help us do so, we are thrilled to have Dr. Dennis Culhane, a Dana and Andrew Stone Professor of Social Policy for the University of Pennsylvania, and a national researcher on the issue of senior homelessness, whose work has been spotlighted by prominent organizations like the New York Times. Thank you so much, Dr. Culhane, for joining us today.
Thanks, Addie. Thank you for having me.
Of course. Thank you for joining us. Now, for those who are very familiar with our community chat series, usually we do a discussion, but for this session, we wanted to first have Dr. Culhane talk more about the research he's done, what it shows us, and give us an overview of what's happening at the national level in regards to aging populations and homelessness. So, Dr. Culhane, I will hand it over to you.
Great, thanks, Addie. I'm going to share my screen because I've grabbed a few slides from a presentation I have on this. I hope folks can see that. I did this work in 2019. We published, a group of us from Penn, Boston University, University of Delaware, UCLA, and NYU. And we looked at the trend in aging homelessness in Boston, New York, and Los Angeles. And it essentially follows a trend that was detected first nationally using census data. What you see here in this graph is when the Census Bureau did the first count of homelessness in 1990. And this light blue curve here is essentially the age distribution. And you can see in 1990, it was dominated by people who were between 25 and 35 years of age. That is a cohort of folks who were born between 1955 and 1965, which is the second half of the baby boom generation. Then again in 2000, the curve moves to the right, and now the group is between 35 and 45 years of age. And then in 2010, it moves again to the right, and it's between folks between 45 and 55 years of age. So you can imagine now we project this to 2020, the average age of 2020 would have been 60, and they would have been between 55 and 65. So there's this cohort of people at risk for homelessness over the last 35 years. And it has been consistent over time. And we project, using the data we had from LA, Boston, and New York, that the number will triple based on a baseline of 2017. The number of elderly homeless people over the age of 65 is going to triple by 2030. One of the implications of this is that it's going to have a significant impact on healthcare costs. People who are homeless are substantially larger users of healthcare services. And this is also true among people who are older adults who are homeless. They're more likely to get hospitalized. They're more likely to remain in hospitals longer than others because they can't be discharged safely to a home. They're more likely also to be discharged to nursing homes because they can't be discharged, perhaps in some cases, even to a shelter, although many are discharged to shelters. But what you see here is just showing as the homeless are getting older, the cost of their care increases on an annual basis. And these are pretty high annual costs for healthcare for any population, including older populations. This is just showing also the nursing home use in particular. That once you get to the age of 65, the rate of nursing home use accelerates quite significantly. I mean, even at age 65, the average person who is homeless and older adult spends 14 days in a nursing home. We did model in this study the potential impact of if we were to fund housing interventions for this population. We estimated it would be about $11,000 per person per year. And when we estimated what would be the offset in terms of reduced use of nursing homes and healthcare in hospitals and shelters included, we estimated that on a conservative side, it would reduce costs by $9,000 and less conservative, $13,000. So if you basically took a midpoint to there, it would show that it could effectively be a break-even investment. So one of the recommendations in our report is to look at ways we can fund housing placements for people who are homeless and elderly and achieve essentially cost-neutral results across shelter and healthcare. And so I'll just leave it at that.
Perfect. Thank you, Dr. Culhane. And I think you touched on, you talked a lot, you covered a lot just then in those few slides. But why is this trend of elder, why is this trend so concerning? Or why should this trend be of concern at the national level?
Well, homelessness among any group, of course, is a matter of concern. It's a tragic thing to occur to people. It's quite traumatic for people to experience homelessness. When they experience homelessness, they're more likely to be victimized, including homicides, more likely to experience increases in mental health and substance abuse problems. And it has a cost to our society. As I mentioned in the slides, increased healthcare costs are certainly a very big factor to take into consideration. That has a big public impact. But there are all sorts of secondary costs as well to our society in terms of parks and police and EMTs and sanitation, the impact on libraries and public spaces and transit. I mean, it really, homelessness has a very substantial impact on public life in our communities. And it goes without saying also that there's a moral cost that, you know, it is a demoralizing thing for us as a society to see that so many people are living destitute in, you know, possibly the richest society in history. And we really, you know, I think that it's not a good lesson to our children. It's a bad sign to the world that we are not taking care of the most vulnerable people among us, people who are elderly and people who are disabled in particular, who account for about 65% of the single adult homeless population. And that's not including, of course, families with children.
That's a really good point. Should this trend be concerning from the perspective of organizations that might be running programs or trying to meet or providing services that might be trying to meet the need of people experiencing homelessness or seniors overall?
Well, the homeless assistance programs, primarily shelters, of course, being the primary approach, were not designed with the idea or needs of aging people in mind. In fact, elderly homelessness was quite rare, you know, going back to 1990, that original graph I showed you. The number of people who were homeless and elderly was really quite small. And it has been this aging of this group at risk, the second half of the baby boom generation, that has, you know, substantially increased the number of people who are elderly and homeless. And these facilities were never designed to support people with those kinds of aging-related needs. Healthcare assistance, you know, various kinds of adaptations and things that people need when they're older. These facilities were not designed for that. Not to mention that most shelters still around the country only operate from 7 p.m. to 7 a.m. They're places for people to sleep. So once the folks are up at 7, they get, in many cases, you know, pushed out the door and have to spend their whole day outside. So, none of these things were really done, and policies are designed with the idea that we would have large numbers of elderly people in these facilities.
Is there anything happening on the federal or state level to address this trend that you're seeing?
Well, sadly, there really is not a federal initiative to address this problem. There was a bill that was, promoted last year around reform of the SSI program, but it didn't go anywhere. And for the people who are watching, let me just mention that SSI is the critical program for income for people who are older and disabled. It's called Supplemental Security Income. It's administered by the Social Security Administration, and it's for people who aren't eligible for Social Security, the traditional retirement program or the traditional disability program. So these are folks who do not have enough of a documented work history of making contributions into the Social Security program, and therefore being vested and eligible for Social Security. Now, Social Security is not a large dollar amount, but even the minimal amount is substantially larger than what folks who have to depend on this SSI income are able to receive. So it's important for people to realize this SSI nationally is around $750, I believe, at the moment, is the monthly amount that people can get. And that is simply insufficient to cover the costs of market rents. As many people probably know, the rental price increases have been substantially greater than the overall inflation consumer price index, which measures inflation, over the last decade and beyond. People who are very low income, people who are, like, for example, who receive SSI, are very often spending 70 to 80% of their income just on their rent. So when the Congress passes those cost of living adjustments for the Social Security programs, those cost of living adjustments don't account for the fact that housing costs are a substantially larger portion of the cost of living for people on SSI and for other very low income people. And so if housing costs are going up much greater than inflation, then it's eating up the resources people have. So very often it leads to more instability. People get priced out of their housing because landlords want to rent to higher income people. So units get converted for higher income purposes. So we're losing housing stock. The people are losing purchasing power in the rental market, and that's a big problem. So one of the things that is needed is a SSI program that's more relevant to this current economic situation. I'll also note that it's very hard to get into this program. There's categorical eligibility for people who are elderly. But it doesn't, the threshold is 65. So people who are under 65 don't qualify as elderly. You have to be 65 and over. As many people may know, African Americans who are disproportionately represented in the homeless population have a life expectancy of about 68, Black males. And people who are homeless, if they make it to 50, it's like 64. So most people won't even make it to categorical eligibility for elderly. At the same time, these are folks who are prematurely aging because of their homelessness and their life experience. They present as elderly at younger ages, as young as 55 and even 50. There is research to show that even people who are 50 have aging-related conditions, people who are homeless, as compared to people who are housed in 65 and over. So, but unfortunately, aging-related conditions don't qualify as a disability by themselves. So remember, there's two categories under SSI, elderly and disabled. And just having aging-related health conditions, heart conditions, diabetes, hypertension, et cetera, does not qualify as a disability. So these folks aren't getting into the program. So literally, most of the people who are homeless and who are disabled are not getting any income from SSI. So the program's eligibility rules are also a big part of the problem. That and remember, SSI was designed over 50 years ago, and it is the fundamental cash safety net for elderly and disabled people, and it's obviously not working. So we do need to rethink the contours of that program because it's a huge contributor to the homeless problem.
So thank you for touching on some really important components there. And I think you talked about it, but I want to sort of explicitly address is that income and that housing affordability, that restricted income and the rising cost of housing, is that what we see is that primary cause of why we're seeing this increasing trend of aging and homelessness? Did I get that correct?
So it's really two phenomena. One is that homelessness, contemporary homelessness for 35 years has been dominated by this one population, people born between 1955 and 65. It's the second half of the baby boom generation, much bigger than the first half of the baby boom generation, who came of age at a very difficult time economically, and many of whom did not get into the labor market because there was all these back-to-back recessions in the early 80s, okay? So you had a sort of a generation at risk, and they continue to be at risk. So this large pool of risk is now elderly. So that's one of the main drivers. Just the risk pool is much larger. But the second is we are in this incredible circumstance where income inequality in our society, which has been growing, is having a huge imprint on the housing market, in large cities in particular, where there are lots of people coming into the housing market, young people included, who are having much higher pay. They're in the tech industries, they're starting salaries at $100,000 and above. Paying $3,000 for an apartment is not very hard for them. It doesn't mean much to them. But raising rents overall in these markets to $3,000 a month for a one-bedroom apartment, let's say, is really having a big impact all the way down into the lower income. It's shrinking the supply of affordable units quite dramatically. So it's this combination of things that is coming together: a larger pool at risk, dealing with a program that's got a lot of problems and failures in it, combined with these market forces in the housing market.
And I'm so glad you talked about that. And recent data for Orange County actually shows we're one of the top 10 least affordable metropolitan areas in the nation and one of the top 10 least affordable counties in the nation. So being able to find housing that is affordable on a minimum wage income is very, very difficult here in our community. Pivoting a bit, Dr. Culhane, who would you say is at the forefront of addressing this issue of senior homelessness, sort of from that nationwide perspective? Is there a community, and could you share some examples that are from communities that are making progress to address this?
Well, sadly, I don't think there is a community that you could point to who's having substantial progress or focus on this. This is still coming onto people's attention. And I think that it is becoming something that folks are more aware of, which is important, but it's still not center of mind. And it certainly hasn't sort of, become a major focus. But, there are certainly programs that target people who are older and homeless, that have been successful at housing programs. There's different places around the country, like the Hearth program in Boston, which has been around for years. There are folks who are trying to do that, but there really hasn't been a concerted policy focus. And so I think that, we're looking to the federal government, we're looking to states to try to take some leadership here.
Are there any best practices that some of the programs you mentioned are employing that you think are working really well that could be expanded or implemented in other communities or at the federal level?
So I think that, there's a lot of work that folks are putting into getting folks eligible for SSI, the non-elderly, but still older adult population, let's say 55 to 64. They don't qualify at 65, but they might appear to be elderly And so there's a lot of advocacy that's working to try to expedite people's access to the SSI income, helping them with the application process, advancing them payment for that SSI so they can get some cash immediately in hand, providing a rental allowance or supplement to the SSI that would enable people to be able to move into some kind of shared housing or independent housing. But very often it's shared housing with family members, friends, relatives, or even in boarding situations. So increasing people's ability to purchase a housing unit or a room, essentially, wherever they can. And then the third thing I would say is being able to leverage Medicaid, which is the health insurance program for people who are elderly and disabled. Obviously, under Obamacare, it expanded to lots of other low-income people. But remember, Medicaid was designed primarily for elderly and disabled people. And the program is not very effective in reaching folks who are homeless. And so we have to really, I think, pay attention to, is there something we can do to leverage Medicaid and the case management services that can be funded under Medicaid? Is there something we can do to get services more directly to people who are living outdoors, who are unsheltered, or even people in shelters?
Thank you. Thank you for that insight. From the sort of looking at from the COVID-19 pandemic perspective, I know that the pandemic has impacted a lot of communities in a lot of different ways. And has made housing instability really difficult for people who are in assisted care facilities. There is a lot of concern about their safety with the pandemic going on. How has the pandemic impacted the trends that your emerging crisis studies, how did that impact the projections and the findings that your study had? And what are some ways that you've seen responses to it, if any?
Well, on the one hand, the pandemic, because older people were more susceptible to severe illness if they contracted COVID, there was provision made to provide hotel rooms or motel rooms to homeless people in these high-risk categories, and elderly people were included. So in many parts of the country, not all, but in many, the people who were over 65 and homeless were in hotels and motels. Not necessarily people 55 to 64, but definitely people over 65 were able to get into hotels and motels. And in some communities, those folks were then placed into programs that were designed to get them housed because they were easier to find and work with them. They were on-site healthcare workers, they were stable in private units. So hotels and motels turned out to be vastly better than the shelters that we're used to as places to help organize people into programs, getting them enrolled and getting them placed in housing. So that was a lesson we learned that I think, and not just in the US, it was actually all throughout the world where it had happened. We saw that there was a big impact of being able to do that. Unfortunately, that program has ended, so people are back in shelters. There are a lot of places around in the US and elsewhere that are advocating for using hotels and motels as an alternative to congregate shelter because of the success that we were able to have in getting people into housing. Now, is it reducing the number of elderly people who are coming into homelessness? We don't have any evidence of that. So the trend, we don't see yet any data that would suggest that the trend of increasing elderly homeless is going to go down. But of course, we'll have to keep watching. We're expecting the 2022 point in time data, national data, to be coming out relatively soon.
Thank you for that. In terms of so you said there wasn't a community that we should be paying attention to that's really doing these best practices, trying to address this. What would be some recommendations that you have for communities who are looking to address this in their community? What are some key next steps they could take?
Well, California in particular, I think, has an opportunity here. First, there are some counties, I know Los Angeles County, who actually have programs in place that are trying to accelerate people's access to SSI. Okay, and we know that's got to be a big part of this, getting people income. And there are already some programs that give people additional money toward rent. And the state's housing assistance money for homeless programs, which is given to the counties, a substantial portion of that could be used to create a rental assistance program for people who are getting into SSI, people who are homeless and older adults or disabled. So I think there's an opportunity with the state housing assistance money, the HHAP money that comes to the counties. The counties have some discretion as to how to spend that money. And very often the programs, it's funding programs that are not directly addressing housing assistance. And I think the most efficient and effective use of those funds would be providing rental assistance to get people out of homelessness who are older adults or disabled. So I think there is an opportunity in California in particular with some of the resources that the state has put on the table for counties to be more effective.
I think you touched on something really key, and it creates a window for maybe community members to get involved. So if we have some community members who might not be part of organizations that are doing this work, how would you recommend, what would be some of your recommendations to them to get our community or the city that they're living in involved in addressing this? How could they create that awareness and really what next steps could they ask their communities to take?
Well, I think that you put your finger on it. Advocacy is really what people should be doing. They should be calling on their county officials, their other public officials, to commit more of the available resources to rental assistance, to double down on the use of Medicaid to help get people into these benefit programs, because Medicaid can pay for benefits enrollment. And, you know, leveraging, these are all federal dollars, by the way. SSI and Medicaid are both 90% federally funded. So it would increase the number of federal resources coming into your community and at no cost to the county. But there is still, of course, this need for rental assistance, some supplement to the SSI. And for that, I think the state money is available. So the advocacy is really to get these resources mobilized. These are entitlements to which these citizens are, you know, they are legally supposed to be getting access to these supports and services. And it is the core safety net that prevented destitution and homelessness among elderly and disabled people since they were created in 1965 and 1970. But they're not working now. They are not working now, and we need to fix them.
And you talked about the rental assistance and the resources coming into our community and the importance of advocacy. And I'm sure some of the folks on the call are aware of this, but for those who are not, United in Homelessness, we have tools and classes where we teach people how to advocate and work and build relationships with their local city leaders and to really get their communities working on some of the issues and some of the things that are happening in their community. And one of the things that we really help our advocates do is advocate for more permanent supportive housing in their community, which is definitely, Dr. Culhane, you're talking about rental assistance and helping that housing affordability and increasing our housing stock. And Orange County definitely needs that permanent supportive housing to come online. And our community, or I should say Anaheim, which is a part of Orange County. Anaheim does have a permanent supportive housing complex that's specifically for seniors called, I believe, El Verano Apartments, which is really important. But we know that that is something that maybe other cities or other communities might be looking to do. So if folks are looking more for more resources on how to get connected to their communities, you can go onto the United 10 Homelessness website. And if you're looking for more information about El Verano, there are posts on our social media, and we'll also drop the link into the chat box as well, so people can read more about that. Well, it is 12:29, and I thank you, Dr. Culhane, for giving us your expertise and your time and really helping us understand what's happening at the national level, because we know that this is a concerning trend across the nation. And like I said, it is something that we're seeing here in our community as well. We saw it in the point in time count data and some other data. We've seen it in HMIS. So thank you, Dr. Culhane, for giving us your time.
Thank you, Addie. Thanks for having me, and good luck.
Of course. Well, that brings us to the end of our time together today. For everyone who tuned into this chat, you'll be able to find a recording of this on our YouTube channel, and you'll be able to also find a recording of it immediately after we end the program today on our Facebook channel as well. We also want to make sure that you sign up for part 2 of this community chat. So today's session was really looking at that national scope, talking about this at that broad level. And today, and on September 22nd, we'll be talking about this from the local perspective. We'll have really prominent leaders from Cal Optima and from the Lived Experience Advisory Committee of Orange County coming to the table to give their expertise of what senior homelessness looks like in our community. So that link to sign up has just popped into the chat box, and there should be a poll popping up on your screen right now where you can give us feedback on this chat. We really want to make sure that these chats improve, that we make them better each and every time. So feel free to take a few moments to fill out that survey. And thank you to everyone who submitted questions, and thank you all for tuning in today. We'll be following up with you shortly with some resources that were mentioned in this event. So thank you, and stay tuned for next month's community chat.